Definition: a patient with stable coronary artery diseases and diabetes mellitus who had not had a myocardial infarction or stroke are at high risk for cardiovascular events. Winter adding together to aspirin improved outcome in this population in the unclear.
So the THEMIS trial is actually the largest trial of diabetes done to date. Over 19,000 patients randomized to either ticagrelor or placebo on top of low-dose aspirin. Specifically, these were patients with diabetes and stable chronic coronary artery disease. Patients with prior myocardial infarction or stroke were excluded. So these were patients who didn't have an indication for DAPT, who were randomized to ticagrelor or placebo and followed for a median of a little bit over 3.5 years. What we found in the primary composite endpoint of cardiovascular death, MI or stroke, was a significant 10% relative risk reduction. And we didn't really just stop there. There was, of course, an increase in major bleeding, as one would anticipate for a potent antiplatelet versus a placebo. But we wanted to see what patients within the overall large THEMIS trial might be the ones where we would really recommend use of either reinitiating or continuing aspirin, ticagrelor, or dual antiplatelet therapy in general. And what we found was that in the large pre-specified subgroup of patients with previous percutaneous coronary intervention, THEMIS PCI, there was a 15% relative risk reduction that was statistically significant and a bleeding profile that was a bit better than in the patients without PCI. There was still an increase in major bleeding, but no increases in fatal bleeding or intracranial bleeding or the most worrisome forms of bleeding. So really what we've concluded then from THEMIS, and in particular THEMIS PCI, is in that patient with diabetes with apparently stable chronic coronary artery disease, they are still at high risk for events like heart attack, stroke, amputation. The addition of ticagrelor to low-dose aspirin can reduce those events, but the physician does need to be careful to select patients that are at low bleeding risk. And in patients with a history of previous PCI, a good thing there is if they've got a stent, that means de facto they've been exposed to dual antiplatelet therapy before, presumably haven't bled, and if that's the case, that they're proven to be at low bleeding risk, those are the sorts of patients where initiation of ticagrelor and aspirin or continuation of current DAPT in that patient with diabetes might be considered.
I was wondering if you could discuss for a minute how you formulated this exploratory endpoint of sort of the catastrophic event that seemed like it was a patient-centered outcome, and what you found there in the overall population in the PCI subgroup, and sort of why you came to look at that endpoint and what it means.
Great question. So that was a pre-specified endpoint, and really the idea there was to look at all the ischemic endpoints that might matter to a patient, because of course people with diabetes are at risk for myocardial infarction, for ST segment elevation, myocardial infarction, ischemic stroke, and we saw significant reductions in all those endpoints in the overall THEMIS trial. And amputation and acute limb ischemia is not conventionally included in these sorts of composite endpoints in these cardiovascular trials, but from a patient perspective, oftentimes that's the worst thing they can think of happening, even more so than a heart attack, losing a limb. And what we found, there was a significant reduction in that endpoint. So when you lump it all together, then there's a quite robust reduction in that mega composite of ischemic events, which again, from a patient's perspective, that's what they need to weigh with their doctor, the potential to reduce those sorts of important ischemic events versus the bleeding hazard that they might be exposed to. So I think these sorts of decisions often do involve a discussion with the patient and their tolerance for different side effects like bleeding. Obviously, cost of medication enters that type of discussion, but then the potential to prevent events like heart attack, stroke, and amputation.
Method. In this randomized double-blind trial, we assigned patients who were 50 years old age or older and who had stable coronary artery diseases and type 2 diabetes mellitus to resist either ticagrelor, plus aspirin or placebo plus aspirin. Patient with previous myocardial infarction or stroke were excluded. Method. The primary efficacy outcome was on composite of cardiovascular disease, myocardial infarction, or stroke. The primary success outcome was measured, blended, and defined by the thrombolysis in myocardial infarction criteria. Results. Participants underwent randomization. The mondial follow-up was permanent treatment. Discontinuous was more frequent, which triggered the placebo. The incidence of ischemic cardiovascular event was lower in the Ticagrelor group than in the placebo group. Results. The incidence of an explored composite of irreversible harm, myocardial infarction, stroke, fatal bleeding, or intracranial hemorrhage was similar the Ticagrelor group on the placebo group. Conclusion. In conclusion, in patients with stable coronary artery diseases and diabetes with some historic myocardial infarction or stroke, those who received Ticagrelor plus aspirin were lower incidence of ischemic cardiovascular event but higher incidence and margin blending than those who received placebo plus aspirin.
Hi, we are here in Paris with Pierre Sabouret. We're commenting the trials of the ESC Congress for PCR Online. Pierre, what are the results of the THEMIS and THEMIS PCI clinical trials?
So we'll focus on THEMIS PCI. THEMIS PCI is a randomized clinical trials evaluating the benefits of dual platelet antitherapy with Ticagrelor and aspirin versus aspirin alone. When you see the results, you have a net clinical benefits with a combination of Ticagrelor and aspirin only with patients with an history of PCI. You have no benefits where there is no history of PCI because you have a reduction of ischemic events, but an increase of major bleeding. But for patients with an history of PCI, you have a net clinical benefits of 1.5%. That means that you reduce ischemic events with low risk of major bleeding. For the other end, the other group, you have no clinical benefits. So it's quite clear for patients with CAD patients with PCI and low risk of bleeding, you can use the dual antiplatelet therapy with Ticagrelor and aspirin.